Hello and welcome to this Q&A from the Fertility Alliance. Today we're talking to Angela Pericleous-Smith, who is the chair of BICA, the British Infertility Counselling Association, which is the body for counsellors and offers specialist training for fertility counsellors. And Angela is going to explain to us a bit about fertility counselling. So Angela, the first thing I wanted to ask you is, I know that a lot of people are quite apprehensive about the idea of going for counselling, but how do you think it can help?
Okay. Morning, Kate. Thank you for inviting me. Yeah, I absolutely agree that lots of people are a bit apprehensive about counselling. Lots of people sometimes feel that there's a bit of a stigma around counselling, but it can be usually beneficial to engage in counselling. I mean, counselling is an opportunity to have like a really safe space that talking therapy to really talk through what you're thinking, what you're feeling, your emotions, and somebody who's with somebody who's a third party, so not attached to you, doesn't have the same emotional investment as say a family member, a partner, a sibling as such. And so it's that safe space to really explore what your thoughts are and what your feelings are, but also in a non-judgmental place, so you're not being judged for what you're thinking or feeling.
So what actually happens during a session? I mean, I think one of the things some people imagine about counselling is it's going to go kind of, back to your childhood and kind of deep analysis of your past and your roots and stuff. I mean, is that what happens in a fertility counselling session?
No, sometimes, but no, not generally. No, it's not like I think sometimes it's been portrayed as, yes, let's lay you down on the Freudian sofa and let's go back to your childhood, and everything you say or do now is linked to childhood. Um, I guess particularly in fertility counselling, more often than not, it's kind of dealing with the here and now and the impact of what's happening now. Obviously, it, in a counselling session, depending on what's going on in your life, there are things that can be linked back or kind of come from childhood. But generally speaking, particularly in fertility counselling, it's the here and now. So it's 1 hour, 50 minutes of kind of talking about the here and now, what your thoughts are, feelings, what's impacting you, and kind of trying to work through those. In terms of, like, I would say a counselling session doesn't really have a structure as such, because you're working with what the client is bringing there, so it's kind of very real time. I'm trained relationally, so I work very relational, like the relationship between myself and the client. Particularly with fertility counselling, there's quite often, in my experience, a lot of like cognitive work to do, cognitive behavioural. There's different modes of therapy, so you will find that different counsellors work in different ways depending on their training and modality of therapy.
And are there common themes that you find that come up quite often with fertility patients?
Yes, definitely. Um, I think there's lots of common themes. Anxiety and depression are quite often high at the top, but then there's kind of different themes in terms of the impact. So, for example, there are common themes in terms of pregnancy announcements, baby showers, lack of control, life being on hold, work, career progress, grandparents. But then there's also the common themes to do with one's self, like self-confidence, body image, sadness, guilt, shame, all those kind of things. And then sometimes also genetics, what genetics means to people, because this is often it's often not something we often think about going throughout our lives until we're in a place of having to walk through the doors of a fertility clinic, and then we start thinking about, do I want a baby? Why do I want a baby? What does having a baby mean? Family, whereas often it's just kind of part of our narrative as we're growing up that we're going to grow up one day, we're going to have a baby, maybe two babies, maybe three babies. We might even have names planned or what we're going to do, as part of our kind of narrative visualization. But the true depth of having a baby, having a family, we often haven't really thought about until we're in the position where it's difficult to have a baby.
I think one of the other things people are often worried about is they kind of feel that it might be seen as a sign of weakness if they go for counselling and that they're not coping, and that someone might, even the clinic, might actually be judging them if they want to go to counselling. Do you find that does come across quite often?
It does. I have to say, I do think it's getting better, but I think part of maybe why it's getting better because of how counselling, because of how we offer remote counselling nowadays as well. But it does come up, particularly clients who do think if they ask for counselling or if the clinic offers it, then they must think it's because they need it or there's something wrong with them or they're not coping. So people do often see it as a sign of weakness, and sometimes men as well, that they're not being manly if they need counselling. So sometimes for patients, clients, they don't want to accept it because they think the clinic might see it as a weakness. They think it might stop their treatment. So there's that aspect. But I think it's just a really good opportunity to offload, talk to somebody, and definitely not a sign of weakness. And I kind of always say that I kind of use that analogy of, if we drive, we take our car to the garage at least once a year for an MOT and a service, clean the oil filters, top up the oil, the water. So what's the difference with our mental health? It's so important, and I wish we were a society where it's seen without any stigma attached.
Do all clinics offer counselling?
All clinics by law have to offer counselling, and the regulator does inspect clinics to clinics need to evidence that they have offered counselling. So in theory, yes. And I think, unfortunately, sometimes it's the way in which clinics are offering counselling. And again, like we've just been talking about, sometimes the way in which patients perceive that they've been offered counselling as, potentially that the clinic thinks they're not coping. But sorry, short answer, yes.
And is it included in the price, or might you have to pay extra for it?
Yeah. Unfortunately, you might have to pay extra. I would always advocate for clinics to include counselling in the cost of treatment, but that's not always the case. And I think one study one patient survey did show that as many as 78% of people would have liked to have taken up counselling if it was free. So I do think that clinics need to include it. Some do, and some are very good with their counselling provision, but unfortunately not all. So patients may need to pay.
And how long should you expect, if you go into the clinic and say, I'd like to see the counsellor, how long should you expect to have to wait before you can actually get an appointment?
Yeah. Ideally, all clinics should be able to see patients within 2 weeks. Sometimes it's a bit longer. I think generally most clinics wouldn't have a waiting list or would try to keep a waiting list below 2 weeks so that patients can be seen quickly. Because I think that's the other thing as well. If somebody has kind of, particularly if you've plucked up the courage to have counselling, you kind of want it then and there, don't you? Or if you've just had bad news, you don't want to wait 6 weeks for an appointment. You want to talk about it then and there. So I would like to think that all clinics are at least working towards, if not able to offer an appointment within 2 weeks.
And how many sessions do people normally need?
I think that's very dependent on the patient themselves. And there's so many variants to that, because you might be having multiple cycles. I tend to find with fertility counselling, it's personally, I find it's very different to any other form of therapy. For example, you may go along to IOP services and have 6 weekly sessions or 10 weekly sessions. I tend to find that fertility counselling is different, in that personally I work very much with where the patient is. So they might be seen once and then they might not want a session for another month or 2 months, depending on where they are in their fertility cycle and what's happening in their treatment. So they might want to be seen before treatment, during treatment, after treatment. So that can all be spaced out. I think it's difficult to quantify a number on the number of sessions of what they need, because for me, it's more about what's beneficial to them.
What happens if you don't click with the counsellor that your clinic suggested?
I would definitely, this is so crucial actually, I would definitely recommend that you seek out another counsellor. I think because you're sharing, or hopefully this is a really safe place for you to share your most innermost feelings, your vulnerabilities. People come to us when they're so vulnerable, those real innermost feelings. I think it's so important that you have that rapport with the counsellor. So if you don't click, I would recommend trying another counsellor. And again, there's no stigma, no shame in that, but if you don't feel comfortable with the counsellor, you're not going to benefit from the counselling.
So how do they find another counsellor? Can you explain to us how you might go about, because obviously you'd want a fertility counsellor, a specialist. So how does someone find a specialist counsellor?
Okay. Well, 2 things first. I mean, one is if the clinic is providing the counselling, it may be that they have another counsellor. That will depend on the size of the clinic, how big the clinic is, whether they have more than one counsellor. So that's one of your first options, to check with the clinic if there is another counsellor that you can see. And again, no stigma in that. That doesn't have to be fed back or anything like that to the counsellor you did see. Failing that, the British Infertility Counselling Association, BICA, on our website, there's a find a counsellor directory. So all of the counsellors in that directory are accredited with BICA or working towards their accreditation. So that shows they're at a certain standard and competent in fertility counselling. So I would recommend having a look on the directory.
I just had one final question, which was about implications counselling, because that's a bit different, isn't it? And people do have to have implications counselling, is that right?
Yeah, most clinics, it is the majority of clinics, it is mandatory for implications counselling for certain treatment options, such as donation treatment, surrogacy. Then the clinic would usually mandate that counselling as a requirement.
And is it a different sort of counselling?
It is different in that obviously there's still the feelings, the thoughts, that sadness, anxiety, but it's different in terms of, I view it very much as an opportunity to really explore the implications of that treatment. So, for example, donation, surrogacy, and the potential implications for you as an individual or a couple, and how that's going to impact you, so that the patient is making a fully informed decision that that is the right treatment option. It's really thinking about those lifelong implications of that treatment. And to be fair, it's not a broken arm, it is something that's going to have lifelong implications. So that's a really good opportunity to really explore. And hopefully as well, the counsellor can kind of share best practice in terms of the research that's out there and what we know about those areas of conception.
That was brilliant. Angela, thank you so much for that very concise and sort of very honest explanation of what counselling is. That was really helpful and really useful. I think that will be really helpful to anyone considering counselling and understanding a bit more about what goes on in a counselling session. So, Angela, thank you very much for talking to us this morning. And we'll include the details of Beaker so that people can know how to find a counsellor when we put this on our YouTube channel. So, Angela, thank you so much.